molecules, Asian Pacific multinationals, third generation command and control system of the Hong Kong police force, and recently in various missions, critical infrastructure of Hong Kong Special Administration Region government in border control facility and transportation. During the third master degree program in University of British Columbia, Canada, his other two Master of Science degree in electronics and MBA was obtained in the United Kingdom. David was urged by his relentless curiosity to explore the nature of human intelligence and artificial intelligence, AL. He challenged himself to join the faculty of Medical Department of Neuroscience in the University of British Columbia to study the human brain, neurological disorder, and related treatment. Okay. His pivotal interests span neuroimmunology, deep brain stimulation, and neurofeedback stimulation that integrate neuroscientific knowledge, AL. And electronic engineering to devise novel treatment strategies in neurological disorders such as general anxiety, depression, major depression disorder, migraine, and Parkinson's disease. He often attended international conferences to discuss the state-of-the-art technologies held by the Society of Neuroscience in Chicago. David is a frequent speaker of this subject for the Chinese and the local Christian societies when he was in Canada. He was also a speaker for neuroimmunology in Institute of Engineering and Technology of Hong Kong. In 2021, and neurofeedback for stroke recovery in 2022 to educate the general public how modern neuroscience and engineering can relieve the suffering that are previously thought of as untreatable or terminal. In his off-work hours, he volunteers to treat advanced stage Parkinson's disease patients. David Cheng is married with one daughter who is a pharmacy student in Nottingham University, United Kingdom, the 8th top pharmacy school in the world. Now, here, can you hear me, Xavier?
Yeah.
Okay, can you talk?
Yeah.
Say whatever you want.
So Mr. Xavier had missed the introduction.
Okay, wait, it's okay. We'll tell him later.
Ask a question, yeah.
Yeah. Okay, can you tell us your friend's experience having Parkinson's, and what is the symptom, what is the treatment, and what are your questions to David Cheng, the scientist, and what do you look to the future? Can you hear us? Mr. Xavier, can you hear us?
Yeah, I can hear.
Okay. All right. Say whatever you want.
I had the surgery for DBS. Next week, in a few days, they will activate it. They haven't activated, so I'm waiting to see the difference.
Did you mean that you have the deep brain stimulator installed in your brain a few weeks ago, right?
Right.
Okay. Why do you make the decision? Was the symptom real bad?
Well, the main reason I went ahead and did it was my age, I'm 76, and they said it's better to do it now than later. And the symptom, although I didn't have a lot of tremors, but since that would get worse with the age, I thought I would get the surgery done now instead of waiting.
Good decision. So you are trying to recover from the cuts from the surgery, right?
Right.
So when the doctor's going to turn on the stimulator?
Next week, I think next Wednesday.
Next week, right? What are the future plan? The doctor say he has for you. Future treatment.
Then they can adjust it. There is some programming.
Oh, okay. They have not tell you the decision yet, right? Yeah.
Yeah, I think the program will start whenever surgery effect will taper. So it will sometime next week. Immediately, Mr. Xavier will find himself energized again. And soon he will be able to have macro movements.
Oh, okay. Macro movement.
If you understand what I mean, Mr. Xavier, then you will walk normally, and unless your Parkinson is affecting your other nerves, for example, your face muscles, then it's a different story. But if it's only mobility that you're talking about, you will find yourself energized just like that is kind of deep stimulation.
So how can he rebuild his neuron?
Well, there's another story. Deep brain stimulation, if Mr. Xavier understands the science behind it, is basically implanting an electrode into a region of your brain called the subthalamic.
It's called what?
It's called STN. You can look that up in Google. Subthalamic nucleus is basically part of your neural circuits of movements. So when you have your neurodegeneration in your movements, that is in the region of substantia nigra, and that circuit will go into your STN, and then the STN will go into your spinal cord and then drive your movement. So it's just like a battery. The neurodegeneration means your battery is running out. And what they did when they put an electrode and a pacemaker just above your chest, it will give your battery a heart kick in a regular pace. Then you will find yourself energized again and be able to move your arms and legs just like it was. But having said that, I have a number of acquaintances. After 12 months into the surgery, the fact that they give your substantia nigra a hard kick does not mean that your neuron does not stop degeneration. That's why the long-term goal to treat Parkinson is still neural regeneration.
Regenerate neurons.
That's the important facts that you have to learn. But before that regeneration is in process, your macro movement will be fine. Your speech may have some problems because the electrode being placed in your subthalamic nucleus is not where you have your speech. But other than that, you'll be fine.
Okay. All right. Now we will ask you to talk again later, Mr. Xavier. And we want Ms. Sharon Hunter to talk. She raised her hand. Can you talk?
Yes, this is Sharon. Good morning. I just want to know, what is Parkinson's? What are some of the symptoms, signs, treatments, that sort of thing? Just give us an overview of what's Parkinson's disease.
Okay.
Okay.
In the PowerPoint, they will start showing that, right? Okay. Then now, so Jesse have no way to show the PowerPoint, right?
Right. Okay.
Why don't you just talk without PowerPoint?
Right. I think that's the best.
Okay,
so
let him start.
Basically, what Parkinson is it is one of the major neurodegenerative disease. It affects around 2% of the adults of those who are over 65 of age, and 3% of the adults if one is over 80. After Alzheimer's, it is the second most common age-related neurodegenerative disease. Clinically, we classify Parkinson into two major types. One type is called idiopathic, whereby the patient suffered loss of smell, progressive loss of mobility, and then followed by weaknesses in speech, weaknesses in other areas, tremor, and subsequently terminal loss of motor functions, etc.
And then dementia, right?
Dementia is the end stage. I will talk about that later. The other major types, about 15% of Parkinson's disease patients will suffer from atypical Parkinson's disease. This one is more lethal and serious, whereby the degeneration happens to cells that drives our internal organ, such as the kidney, the intestine, etc. So people with atypical Parkinson will suffer from, in addition to the Parkinson's disease, they will have frequent outages of the intestine and kidney functions. They will have very strange eye movements, sometimes without tremor, but usually with visual hallucinations, and they have difficulties in balancing and eye movements, etc. Now, when you talk about Parkinson, usually it goes into 6 stages. Without boring you too much into the initial stages, you will start feeling. Whoever suffers from Parkinson, it's not you. I'm sorry for the speech. What I meant is patients in Parkinson will start feeling about suffering from Parkinson from stage 3, when they see the smell will be impaired, when the movement agility impairment starts, etc. And tremor begins in stage 3. And when you go to stage 4, what they will see is the verbal memory starts to deteriorate. They will find spatial navigation challenging. They will find impairments in space-time related dimensions. They will have nightmares. And by then, it will have substantial mobility symptoms. When you go into stage 5, the long-term memories starts to degenerate. The patient will have planning problems. Notably, one of the hallmarks is they will have a dry or double vision. They will have problems with sensory motor integration. And stage 6 is terminal. The memory became degenerated in such a way, we call it Parkinson's disease dementia, and organ function impairment starts. Then all the way until the patient passes. So briefly, that's what Parkinson is all about. Does that answer your question?
Okay, can you talk a little bit more about the idiopathic PD symptoms? on stage 3? I know that your PowerPoint have 10 points about it.
Yeah, what Parkinson's symptoms occupies around 85% of the Parkinson's patients. So people that suffer from IPD, you will find their movements rather rigid. They will have stooped posture. Some of them has masked face. They will need to forward tilt. The arm swing will reduce when walking. The hands will have tremor, as well as the legs. They will suffer in a short step gait. In other words, rather easy to fall. And slightly flexed hip and knees as some of the symptoms. Yeah, that goes on and on.
Okay. Now,
Mark,
yes.
Sorry, I missed one point. Is constipation.
Oh.
Very normal even in stage 1 of Parkinson. Patients started with constipation symptoms. So if any one of us going into 40s, 50s, and then you have constipation problem, you should start concerned about whether it's early signs of PD.
Oh, I see. Yeah, I see from your PowerPoint that I jot down 10 points. The symptom. One is the stooped posture. The second one is a masked face. The third one is back rigidity. The fourth one is forward tilt trunk. The fifth one is flexed elbow or wrist. The sixth is reduced arm swing. The seventh is hand tremor. The eighth is slightly flexed hip and knees. The ninth one is tremor in legs. The 10th one is shuffling short steps and gait. So can you derive a little bit more from those 10 points?
Oh, these are just clinical symptoms. Not all Parkinson's patients has all 10 clinical hormones.
Yeah.
But the thing is, very common is constipation and loss of smell.
Oh.
Yeah, and when the Parkinson protein goes all the way to stage 3, then a significant percentage of the 10 symptoms that you described will appear.
Yeah. Okay. Now, I know that Miss Kayla Hinton has a friend who has a great treatment from Parkinson. He didn't need to do the stimulator yet. Can Kayla, do you want to say a few words?
Hi.
Hi.
There is a program that is basically just a boxing program for people with Parkinson's disease. They have volunteers that basically come and help during the sessions, and it has shown that this physical activity through boxing has helped help people with Parkinson's avoid that progression.
How do you apply? Is it a foundation or scholarship or something?
So the Parkinson's Association, the Alabama Parkinson's Association, they have a scholarship program for those that want to apply and participate in the program.
Okay, Alabama Parkinson's Foundation scholarship?
It's through the Alabama Parkinson's Association.
Mm-hmm. I see. So, how good is that boxing program? How effective is it?
It's pretty good. I mean, people who participate, it shows that their progression is not as accelerated. But I also have friends that not only have the boxing, but they also are engaged in physical therapy twice a week, in addition to the boxing twice a week.
Oh, I see. Yeah. Then when I talked to Mr. David Cheng before, and he said that mostly the American approach is to give the Parkinson patient more and more drugs, more medicine to help them to eliminate symptoms. But he told me that there's another concept of don't overload on the medicine. Use other method to help the patient. What do you think, Mr. David Cheng?
Yeah, that's right. When a patient is being diagnosed with Parkinson, usually the Western medical approach is to start offering them a drug called levodopa. Now, what this drug is basically dopamine. Maybe I should tell the audience what Parkinson is about. Fundamentally, it is about the neurodegeneration of a cell a type of cell in the brain called dopaminergic cell in a particular region of the brain called substantia nigra. And when this dopaminergic cell degenerates beyond certain percentage, then the dopamine flow in your brains will simply less and less. And the lesser dopamine that you have in your brain, the more challenging it will be to drive your mobility functions within your body. So that's the theory. So around 35 years ago, people start giving these patients external dopamine. So when this external dopamine go into your brain, then they thought you have a molecule that when you need them, the brain will use these molecules to drive your circuit, and therefore you should be run fine. Now, the theory works well in the initial stage of Parkinson up to stage 3. And usually when patients start taking more and more dopamine because of the neurodegeneration problem, as you could imagine. But as you progress to stage 4, what happens was not only one needs the molecule to drive your movement, you also need the signal to drive the movement. But as you could imagine, if your battery runs out, although you have the molecule, you no longer have the power to drive the circuit. And that is the problem. And when doctors see that, some of the doctors in clinical practice will start offering people more levodopa. Now the problem with that is when you have more than 3 levodopa a day, because if you are in advancing the Parkinson to stage 4, you don't have the battery. You only have the molecule. What that ends up is you will have more molecules in your synaptic cleft. In other words, in your brain, not in the cell, but not the power that drive the molecules. As a result, the patients will not move, but instead will suffer from another symptoms, what we call the restless legs syndrome. And the patient will find themselves, their arms or the legs or both, moving involuntarily, non-stop, until he goes fatigued. That's not a good sign, I can tell you. And they will need to give you another drugs to contain that thing. I see a number of patients being treated that way in some parts of North America. I cannot tell you which state, but they are prescribing patients beyond 6 levodopa a day. And I would strongly advise whoever it is not to take beyond 6 because that will be life-threatening.
Will Mr. Xavier turn off your camera for a minute?
I heard that recently some states in the U.S. start prescribing people with 9 levodopa per day. God bless. I really don't know what will happen then. They're trying. I think whoever prescribed that, without offense, they are testing certain clinical trial on the patients without scientific basis. That's what I can tell.
Yeah, but I know that you self-taught to learn some Chinese herb and Chinese medicine. So what is your suggestion, approach to handle the Parkinson symptoms without overdosing the patients?
It's not from the Chinese medicine, but maybe I should start. When people are advancing Parkinson stages, usually the treatment starts from levodopa, as mentioned. But as they advance in stage 4 or above, people will start offering them deep brain stimulation.
Stage 4.
Yeah, or above. And the problem with deep brain stimulation is, as mentioned, you will find yourself having good macro movements, and the DBS will last the patient for another 10 to 15 years if he's lucky. But it doesn't stop neurodegeneration. That's the problem. And so within 12 to 18 months from deep brain stimulation, the patients will suddenly find themselves having easy imbalancing, or what we call ataxia problem. That's because the electrode only stimulates part of your mobility circuit and not the other part. So you will have some other parts energized and some other parts don't. And if your neurodegeneration persists overall, right? So you will suddenly find yourself having waist injury or easy to fall kind of symptoms because of imbalance between the macro and micro movements, as you could imagine. So when I came back to Hong Kong in 2020, what happens was I met a number of acquaintances that suffer from problems in deep brain stimulation. And
Jesse did it.
And what?
Jesse did it.
And these patients, frankly, cannot be treated by existing protocol in Western medicine. And so in order to help them further, I looked into the biology of Parkinson. And let me tell you what this is.
We see some screen now. Is it Jesse showing it? They have the human head, the human brain system neuroscience of idiopathic Parkinson's. So do you want to go forward or backward?
Okay, good. Thanks, Jesse.
Which PowerPoint page you want to go to now?
11, if you would like to
11?
show.
Okay, Jesse, can you find 11? Okay, let's see. Disclaimer. Okay, then. Okay, it's the 11.
Okay, let's go into the molecular neuroscience of Parkinson's disease. Yes.
Molecular neuroscience. Let me see.
Okay.
Oh, I see it. Okay. Yeah, I see it. Okay.
So, to tell you what exactly Parkinson is all about is, if anyone still remember your good old days biology in high school or in uni, if you are studying biology, every cell within ourselves does have a little battery, what we call the mitochondria. And that's where your energy to supply your cellular daily needs are being manufactured, most of them. Some of them still come from your cytoplasm, but mostly they are coming from mitochondria. So when people get aging, particular parts in mitochondria for some of the people will be more severe, and then they lead to a cellular energy supply or demand imbalances. And when that happens, when you don't have enough energy offering the cell to complete all the cellular process that it needs, the demand and supply start negotiating for what they will do with less energy, as you could imagine. And for 2% of the people, this less energy implies that some proteins are being misfolded. And when it's misfolded, some of the usual protein or byproducts of this normal cellular process starts binding together in multiple of 6. And therefore, they what we call oligomerize into a lumpy protein from a normal protein called alpha-synuclein into a lumpy protein called Lewy body. And this is what Parkinson's is all about, whereby the Lewy bodies will attack the brain cells called astrocytes and microglia, and that causes the neuroinflammation. And when there were an inflammation in astrocytes and microglia in large scale, they in turn attack the substantia nigra neuron that kills the neuron. So it's kind of a mutual destruction between some of the major cellular systems, and that was what Parkinson is all about. So if we understand the biology, if you are still with me, we can turn to slide 17. Thanks, Jesse.
How about that movie?
Oh, no. Don't go into that movie then. Let's go into slide 17.
Right. What's the name of the topic? What topic is it?
Okay, so I'm going to tell you what current treatment of Parkinson offers.
What page is that?
It's slide 17.
I'm sorry, I can't see the numbers on my phone.
Tell her the topic.
And Chris is going to try to open it up in a better format.
Tell her the topic.
So far?
What is it?
What is offered so far?
Oh, what is offered so far? Okay, let's look for that. What is?
So in Western medicine.
No, wait. Let her look for it. What is offered so far?
Let me see.
Okay.
Okay, you already have the slide, Jesse. It is one slide.
Oh, I see that. What is offered so far? Yeah, I see it.
One slide above the neurobiological treatment.
Yeah.
Okay, so what you have in the U.S. medical system is that all the treatment are only relief treatment. There's no cure, because none of that deals with neuroregeneration. And you either end up in levodopa, that you will end up in a medication program that easily costs around $2,000 per month, or you go into a deep brain stimulation surgery that will cost around $100,000 a month for the surgery, and then there's followed up by another levodopa treatments. So when I have all these end-stage Parkinson patients who is trying to seek for my help, most of them don't have these monies, unfortunately. And so I was scratching my head how to treat them with a low-cost therapy. So possibly that will benefit the wider community too. And as we have more and more elderly patients going to 65, and the fact that the medicine is getting even more expensive nowadays, maybe we give it a try. So what I end up with, and with the patient's consent, is we try to go back to the biology of Parkinson and try something natural. So before I start, you have to know that this treatment is not FDA approved on your side. So if you think that if it's not FDA approved, you will not try it, help yourself. It may not be suitable for the U.S. system. So it's basically based on Parkinson's disease neuroscience, and we try to find a way to strengthen the patient's immune system so that their own system tackles the Lewy body that I just talked about. So what is this about? Is basically in Parkinson, the reason that this Lewy body can damage your brain cells is because your brain own defense processes are slowly dying. Lewy body happens in all type of normal person like you and me, if we don't have Parkinson. But what happens is why it doesn't happen to you and me instead of some Parkinson patients is because the neural defense system in you and me are normal, and for anything abnormal are being eaten away, in a simple terms. So the theory is, what if we can revive all these defense processes? Can the neural system regenerate itself? That was the theory. So the next slide is, I go back to the slide is called Molecular Neuroscience of Parkinson's.
Molecular. Okay, hold on.
Yeah, one slide after the neurobiological treatment.
Okay. Here, right here. Molecular neuroscience of Parkinson's. Yeah.
Right. In a normal brain, there should be two defense systems. One defense system is outside the cell, what we call intercellular, between cells. And this system is called phagocytosis. And the theory is, if we have a lumpy protein going through our brain, it's supposed that the microglia cell system is supposed to eat that away by phagocytosis. But unfortunately, for Parkinson's disease patient, this process is dead. So that's one of the reasons why this lumpy protein can prosper and cause more of microglia and astrocytes to go inflammation. The other system is even more lethal. If this lumpy protein goes into our cell, and then they will choke off the cell to death. In a normal brain system, we have another process within the cell, what we call autophagy. And when an autophagy is normal, whatever foreign protein or unknown protein goes into it, we are supposed to be able to digest it away. Now in Parkinson, all these two processes are impaired. Can we revive it or strengthen it so that it revives, so that we can treat Parkinson without surgery or medication? This is what neurobiological therapy is all about. So to cut the story short, let's go to slide 22.
We still have 12 minutes. Okay.
Okay.
Somebody
Okay.
talk.
So what if we re-energize the processes? So if we want to re-energize.
What slide should we be at now?
Oh, it's slide 22.
But no, don't tell her the number. Tell her the topic.
What if we re-energize the process?
Oh, here it is.
Okay. And if we re-energize phagocytosis, all you need to do is go to your pharmacy and then buy coenzyme Q10.
CoQ10.
Yeah, that's easy.
I take that.
Okay, and anybody can take it. And at the same time, you reduce taking in sugar.
Cut down your sugar intake.
Cut down your sugar to 5% of your serving. And people will say, okay, if I don't have carbohydrates, if I don't have sugar, I cannot live. That's wrong. You can take a Mediterranean diet or keto diet. That reduce your sugar energy combustion in your body. And what it does is to limit the damage to your mitochondria. And what coenzyme Q10 does is to energize your mitochondria. And when these two go together, Parkinson patients suddenly find themselves be able to feel energized again. Now, this is the first step. The second step is even more interesting, is to go on to time-restricted eating. This is the next slide. Process 2, revival of autophagy. And what it does, it asks you to do 16 hours per day, no food, and 8 hours a day, food. Very simple, right? And amazingly, this method was being discovered by a Japanese professor of medicine, Professor Yoshinori Oshumi, and he won the Nobel Prize of Medicine in 2016. And what that we look for is to revive your raw nature of cells. In other words, usually when a cell is in raw nature, they will wake up and find that, oh, there's some foreign things that I don't like. Let's eat and digest that foreign protein. And that's revive the autophagy. And this process of 60 hours without food, 8 hours on food is also very helpful for people who want to go on diet. So I advise whoever wants a lesser belly, try it too. It works very well. Now, process 3, how do we regrow dopaminergic cell? And what we need to do is to stimulate the growth environment in your brain. Usually, after you take around 6 to 8 weeks in the process 1 and process 2, then the patients will feel themselves progression of Parkinson's being arrested, and then we are ready to foster a growth environment in the system that will regrow the lost dopaminergic cell. And what it has,
yes, somebody may need to turn off the
with
microphone.
the acquaintance that I have, I ask them to either eat yogurt or mushroom. That's even simpler. Natural foods does offer a lot of growth factors to our brain. So just taking mushroom and yogurt will already enhance our brain-derived growth factors. Different people have different effects, but it's quite effective.
That's easy. Mushroom and yogurt, I can eat it all day.
Yeah.
Okay.
And therefore, when we combined all these 4 treatments together, I find that it works really well to complement existing medicine. Whether the patient underwent deep brain stimulation or they underwent levodopa, whilst those treatment is offering you clinical treatment, this neurobiological treatment complements them by growing back your neural system. So the two things work together really well. And so far, in the next slide, when we see the hence novel neurobiological treatment, I find that we have worked with idiopathic Parkinson patients up to late stage 5, and it still works really well. And also, one of the interesting things is I recently is working with acquaintance that are suffering from atypical Parkinson's disease. And in the past, levodopa and deep brain stimulation doesn't work on atypical Parkinson. But now there is this neurobiological treatment that relieves the symptoms of APD. So it works really well too. And it's cheap, as you would imagine, just buying some Q10 from pharmacy, some yogurts from Walmart, and mushroom from Walmart will not break your purse. Right, and it's natural. Everybody can take it. So, interesting treatment that we have. Unfortunately, I was not able to show you the video of some of the success cases. What we have is a patient who used to be a musician, and he was my first acquaintance, actually. So, just to tell you that what will happen, after 6 months in the therapy, he used to be lying on bed in late stage 4 in 2020 when I first met him. And he undertook deep brain stimulation. By 2022 early part, his side effects from DBS came in, and he easily fell and has all these imbalanced mobility problem, as I mentioned before. And by taking neurobiological treatment as a complement to his existing DBS, he was able to sit up after 6 months normally and play piano. So maybe if we have chance to go through the PowerPoint sometime, you can play that and you can see the effects. But after 6 months, even after 6 months, his speech remains slurring. He easily suffers fatigue, just like before. He still have nightmare. He has poor sleeping quality, and he still have constipation. Now, after 13 months, not only is his piano playing resumed, he can sing solo. So if you were able to receive the PowerPoint I sent to Teresa, enjoy his voice. He's one of the best tenor in the church. And you can hear from his singing that his speech accuracies are much improved, and he has less frequencies in nightmare dreaming, and his sleeping quality improved, and his constipation has much improved. He used to have only one episode per week. Now he can have 2 to 3 episodes per week. So his constipation is much improved. So this is his research progress. He just told me last month, 16 months in the therapy, the hospital is scratching the head and try to test how come he can move even without deep brain stimulator. So what they did, they stopped his DBS stimulator, the pacemaker, over his chest for 1.5 hours and stopped all the levodopa for 14 hours. And then they conduct the usual Parkinson clinical assessments. This is the list I show in here, and it shows that it's all normal. But of course, it's not as good as having full medication DBS on, but he's saying that it's around only 30% less than normal, but still good. and he also passed all the clinical psychological tests. So what this means is, after 16 months, having all these 4 neurobiological treatments, some form of neural regeneration is taking place. That is something that I cannot do because I'm no longer with UBC. I will not be able to put him into an MRI chamber to understand how much has been regrown. But judging by his clinical progress, I believe that the brain has substantially been regenerated. So this treatment is free. Well, it's low cost anyway. It's not free. You need to buy it from pharmacy.
Okay, I know that somebody want to talk. Can you give them a minute? And whoever want to talk, can you start talking now? We only have 2 minutes left. Go ahead. Anybody want to talk?
Somebody
want to ask.
You want to go into all this treatment, make sure that you consult your
doctor.
PE.
Yeah.
Right?
Okay. All right, whoever want to talk, can you go ahead and talk?
It's different.
Okay, I have a question.
Okay, go ahead.
Do you find situations where you're treating patients for both MS and for Parkinson's?
I'm sorry.
Or with this work for people who have MS as well, you think?
AMS stand for, is it AMS you mentioned?
You say MS, right? What does MS stand for?
Oh, you mean multiple sclerosis?
Yes.
Yeah, okay.
Right. Multiple sclerosis is another part in the mitochondria that suffers from neurodegeneration. The official answer is I'm not sure, but the unofficial answer is I can tell you what is being tried at the moment when it comes to MS.
Okay.
They try to give people keto diet. So you see in the 4 treatment that I mentioned, instead of giving them Mediterranean diets, they have to give them the keto diet. Time restricted eating is still there, and disciplined life with restrained daily activities is still there. The yogurt and mushroom is still there. So far, the trial is happening in selected parts in Virginia, and the report shows some positive signs, but there's no conclusion as yet.
Okay,
So
can David show me some ketosis diet so I can email it to everybody in the pack in the future?
You can search Google. Keto diet is everywhere.
Okay, no, I want you to give it to me so I send to them because my pack member, they may not want to search Google. They may want to get it from you. So anybody else have any quick question now? Because we only have minutes past. Any more questions?
Distribute.
Anybody? Any more questions?
Yes, I have one.
Quick.
Is there actually anything that can be done to prevent getting Parkinson's disease?
Prevent. How do you prevent it, David?
All right. When you are around, well, put it this way. Some people has family Parkinson problems. I cannot say that you can 100% prevent, right? As usual.
Oh, okay. David, stop 1 second. The audience, if you have to go back to work or go back to the phone, you go ahead. If you have break time from now on, you can keep on with meeting. Okay, continue, David.
Okay. But I often advise my people, friends, etc., if you really want to prolong before you have all these neurodegeneration symptoms, starting from your age of 50, take 1 tablet of vitamin B6, 1 tablet of vitamin B12, and 1 to 2 100 mg of Q10 per day.
100 mg of what? CoQ10?
Yeah.
Oh, CoQ10.
Don't take it together. You can take 100 mg in the morning, 100 mg in the afternoon.
B6, B12, and then CoQ10, right?
Yeah. And try to cook yourself some mushroom. It's good.
Mushroom, like yogurt.
Okay. And
That's easy.
I've heard of people that said they contracted Parkinson's disease from the Vietnam War, Agent Orange. Does that kind of stuff cause it?
No, there's no scientific proof for that. What Parkinson is all about is because people used to work in from what I know, it's basically because of a stressful lifestyle that accelerated the aging of the system. For example, people has hypertension due to the stressful life, and this hypertension releases what we call the reactive oxygen species within your body, and that is the major cause of aging within your entire system. And Parkinson will show in Parkinson.
Well, like Muhammad Ali had Parkinson's disease, and someone I was told he got it from being hit in the head so much boxing.
No, there's no evidence.
There's no evidence to support that. Okay,
No.
thank you.
No. If it was Vietnam War, then we don't have Parkinson. Vietnam War is 1974? It's 50 years ago. Then how come we have Parkinson today?
Yes. Thank you very much. Good presentation.
Okay, Mr. David, you say that the 200 mg of CoQ10 and the B6 and B16 or B12?
Or B6?
B6 and B16 or B12?
No, and B count.
No, not B16, right?
There's no B16. No.
B12, okay.
Not I'm aware of.
Yeah, okay. If you have to go back to work, you can leave the meeting, and if you are on a lunch break, you can keep talking. So anybody have any more question? David, have any more thing to say? And Mr. Xavier, you have anything to say? Oh, one thing I know, my friend told me that somebody with Parkinson's disease, the doctor implant a medicine dispenser in underneath his skin in his belly, so the medicine will come out gradually instead of intaking by mouth every 4 hours. But then in the third hour, near 4 hours, the patient have no supply of the medicine. So then I wonder if that will help a lot. Somebody has it implanted.
It's a mechanism of administration, really. What the medicine is all about is still levodopa.
Oh.
So the effect is the same.
But it will dispense slowly instead of.
Yeah, that's all it is.
Yeah. So now the audience, everybody have received their PowerPoint that you have to open it after you transfer it from the government email address to your personal address, right? Okay, Mr. Xavier, do you have anything else to say? Huh? You can unmute yourself. Okay, you want to say anything else? Anybody?
Yes, thank you. It's a good presentation.
All right. Okay, now, goodbye and God bless everybody. And then we